Hello everyone! Today we're going to delve into the topic of oral health and how you as primary school teachers can help to educate children about how to look after their teeth within your classrooms. Tooth decay is one of the most common oral health conditions affecting children, but it is also preventable. As teachers, you are in an ideal position to inform young children of important behaviours and concepts, which will in turn encourage positive attitudes towards the dentist and supporting good oral health habits. In today's video, I will be discussing the 5 main concepts that should be discussed when teaching about oral health. So these include the functions of teeth, how and why tooth decay happens, food and drink that can affect oral health, what good oral hygiene entails, and what children can expect when visiting the dentist. Let's start by looking at our teeth. This is a great way to start a discussion about dentistry with children and introduce the topic. So why are teeth so important? Firstly, teeth help us eat. Chewing our food into smaller pieces makes it easier to swallow our food to enter our digestive system, so we can absorb all the nutrients that we need. Teeth also play an important role in speech. Working with the tongue and lips help to produce specific sounds when we talk. Finally, teeth are also used for smiling, which is arguably the most important. Our teeth come in all shapes and sizes, and we have different names for them. So we have incisors at the front of our mouth, which we use for biting and cutting. Next to these we have canines, which are slightly more pointy, and we use these to tear food. And then we have the larger premolars and molars at the back of our mouths, which grind food when we chew. Now let's have a quick chat about baby teeth. So children have 20 baby teeth, which begin to fall out from the ages between 5 and 7. These will then gradually be replaced by 32 adult teeth. However, our baby teeth are still so important to guide our adult teeth into the right places, so they need to be looked after just as much as our adult teeth. Next up, what actually is tooth decay? So, tooth decay is also known as dental caries, and despite it being a preventable disease, it is very common in childhood. It involves a cavity in the tooth that can cause pain and infection, and it is most commonly described by people as having toothache. Our mouths naturally contain millions of bacteria, and some of these bacteria feed on the sugars that we eat to produce acid as a waste product. This acid attacks our teeth, and this results in holes that we call cavities. Tooth decay can be managed and prevented through regular trips to the dentist for a checkup, limiting sugary foods and drinks, and having good oral hygiene habits. So we will discuss all of these in the following slides. A big risk factor for tooth decay includes sugary food and drinks, because the more sugar available in the mouth, the more acid produced as a result of more bacteria feeding on it. Examples of food and drink that make up a high sugar diet include things like sweets, cakes, and biscuits. Another important idea to discuss is that it's not just the amount of sugar in the food, but also the frequency of this sugar consumption. So for example, eating a chocolate bar in one go is much less harmful than sipping a sugary drink all afternoon, because there's less frequent acid attacks on your teeth. It's also worth remembering that even items that seem healthy, such as fruit juices, contain lots of high natural sugars that still pose a big risk to tooth decay if sipped frequently. This is a great opportunity to encourage healthy eating habits for children, such as drinking water and milk between meals and eating fresh fruit and vegetables. The main advice to give would be drinking water, having occasional sugary treats with meals, and avoid frequent snacking throughout the day. Alongside the healthy diet we have just discussed, another way tooth decay is managed is through good oral hygiene habits. Every day, a sticky layer of bacteria forms on the surface of your teeth, which is called plaque, and this needs to be removed regularly through toothbrushing, otherwise this can result in decay, bad breath, and bleeding gums. The key messages to share include brushing teeth twice daily, so this would be once in the morning and once at night for 2 minutes. Use a pea-sized amount of toothpaste on your toothbrush, and this toothpaste should be a fluoride toothpaste. So any common brands such as Colgate and Oral-B will have fluoride. Fluoride is a mineral that makes the enamel in our teeth stronger, and it helps to repair any early stages of decay following acid attacks. Brushing all surfaces of your teeth using gentle and circular motions is really important, and ensuring to brush all surfaces. After brushing your teeth, spit your toothpaste out but avoid rinsing with water. So that means that the good fluoride remains on your teeth for longer, so it protects against any tooth decay much further. Visiting the dentist can be overwhelming and scary for lots of people, so encouraging children from an early age and creating a positive attitude surrounding that environment is a great way to establish lifelong habits and to reduce any dental anxiety. Dentists check teeth, fix teeth, and also teach you how to look after your teeth. It's important to discuss that visiting the dentist as part of regular checkups is super important compared to only going when you have something wrong, like toothache, because it allows the dentist to identify any problems early on to help resolve them, which means it will be much quicker and more comfortable than if the problem was to get more serious. So, what should be expected when you go to the dentist for a checkup? Explaining to children the different stages that make up a dentist appointment is a great way to reduce anxiety and help them feel more prepared for their visit. Here are the key points to include. So the child will head to the waiting room and wait for their name to be called. They will then head into the dentist's room where they will meet the dentist and the dental nurse. The dentist will then use a small mirror to look at all the teeth and gums inside their mouth. This will be done to count teeth, look at baby and adult teeth, and also help to teach the child how to brush their teeth correctly. Sometimes the dentist paints some banana-tasting liquid on their teeth, which is called fluoride varnish. This helps to protect their teeth and reduces the risk of cavities. At the end, as a big well done, the child will get rewarded with a big sticker. To summarise, the key messages that the children should remember include brushing twice a day with fluoride toothpaste, less sugary food and drinks with less snacking, and ensuring to visit the dentist regularly for checkups. This will aim to keep their oral health at a good standard and reduce the tooth decay rates in young children across the UK. There are many free online resources and activity ideas that can help build some great interactive sessions within your classroom, which I have compiled as an attachment. There are also resources that can be sent home to encourage good habits, such as toothbrushing charts. I've put some examples on the screen, but please feel free to have a look at the attachment and bring some of those ideas to your classrooms. Thank you for your time, and I hope you have found this video both interesting and useful. Good luck and have fun!